Today, Florida health leaders took another step forward in addressing medical treatment for transgender kids in Florida.
It's all part of a goal to set a statewide standard for care for patients under 18. News 6's Brian Didlake takes a closer look at the plan moving forward.
Matt Ginger, as it stands now, the proposed rule by the Florida Board of Medicine will still ban transgender treatments for minors unless it's in clinical research. This has been met with strong views from all sides.
The motion carries. Thank you so much, and the meeting sat adjourned. You have a nice day.
With angry outbursts, the Florida Board of Medicine's workshop ends. The meeting held at Orlando's Hyatt Regency saw public testimony as well as board members hearing from experts on the approach and treatment of gender dysphoria in young people.
What you're talking about is waiting until age 18. Well, they won't be here. This group commits suicide. They will not be here. So we need the medication, please.
Is it not the best practice to address psychopathology with approved psychotherapy before instituting life-changing, unhealthy transition treatments?
During the workshop, crowds criticizing the shortened public comment, including lawmakers.
Complete frustration. The Board of Medicine once again cut off public testimony as nearly 40 to 50 people were waiting to still speak.
The meeting comes as the board is deciding on a ban of some treatments for transgendered youth to align with guidance from the Florida Department of Health. The ban will cover things like gender reassignment surgery and puberty blockers.
I worry actually more about the fact that that research is not happening in Florida at the level that it should be.
Equality Florida, a LGBTQ plus rights advocacy group, hosting a virtual conference directly after the board's workshop.
I can't speak to specifics at this moment, but as I said, we're actively litigating the Medicaid ban on gender-affirming care, and we're in conversations with lots of different state and national partners about this upcoming rule. So unquestionably, there will be legal challenges.
But some crowd members stand strong in their belief.
My recommendation to the Rules Committee is that cross-sex medical and surgical treatment should not be supported by organized medicine.
While others say,
I would like to see the Board of Medicine uphold the existing standards of care that have been laid out by the World Professional Association for Transgender Health.
Now, the next meeting will be held here in Orlando next Friday at the Holiday Inn at Disney Springs. There, we expect continued discussions on the rule and a vote to finalize the rule.
Brian, I know you've been covering this since the very first meeting. Do we have any idea what we can expect to hear next?
Yes, so towards the end of the meeting, there was some confusion of informed consent. When taking transgender treatments, the language that will be put into the rule was hazy, which is why 2 of the board members voted no when approving the language, the current language, so that, at least one thing we can expect to hear. But as a reminder, board members have until December to finalize their decision, so we will have to wait and see if things change before that vote.